Okay. So good morning, everybody. Welcome to Walker's webinar. We have here with us today the Washington State Healthcare Authority's Foundational Community Supports Team. They're going to be presenting with you guys today. And at the end of this webinar, we'll be sending you guys a survey and I believe the slides as well. And then a recording will be up within 24 hours on our Walker website. So I'll let you go ahead and take it away.
Awesome. Thank you so much, Blair. Thank you for the Washington Alliance for Quality Recovery Residences, or Walker, for having us join you today to review the Foundational Community Supports Program, or what people commonly refer to as FCS. And I feel like quite a few folks in this room may have heard of FCS in the past. And if you haven't, we have quite a bit in store for you today. But if you have or haven't heard of FCS, I would really love for folks that are in the room to share what they would like to get out of today's session. I think it's really critical that we answer all the unanswered questions that are out there, and we're going to try to do that throughout our presentation today, but want to make sure that we cover everything that the folks here in the room would like us to cover. So again, if you're able to go ahead and drop those ideas or thoughts in the chat. And we'll track those, and if they don't get covered during the presentation, we will try to cover those after in the Q&A session. Just real quick, wanted to say hi and introduce myself as well. My name is Scott Tankersley. I use he, him pronouns. I am the Foundational Community Supports Program Administrator with the Healthcare Authority's Division of Behavioral Health and Recovery. And I'm joined by a few folks that are on the same team as me here at the Healthcare Authority. And you'll see them on the screen as Darren Paschke and Kimberly Castle. And maybe they can do a quick introduction of themselves too. I'll pass it over to Darren.
Hi, thank you, Scott. Good morning, everyone. My name's Darren Paschke. I use he, him pronouns as well. I bring over 30 years experience in supportive employment and expertise in developing supportive employment programs and implementing the individual placement and support, the evidence-based practice for supportive employment. Thank you for having us back again.
Good morning, everyone. My name is Kimberly Castle. I am the Foundational Community Supports Quality and Alignment Analyst here at the Healthcare Authority. I go by she, her pronouns. Previous to this role, I was the Supportive Housing Program Manager for Western Washington, so may have spent some time with many of you doing a presentation of this in the past. So it's nice to see everyone that's here again.
Yes. Thank you so much again for having us here again. And that's kind of part of why we want to make sure we're answering all the questions that you have. So if you've been to previous presentations, please do make sure you highlight what you didn't get out of the last ones so we can address those thoughts and ideas throughout this presentation. And with that, I'm going to put your eyes on the agenda today. And so as I said earlier, we're here to talk about the Foundational Community Supports Program, or FCS. And so we're going to start off with a pretty broad overview of the program. We're going to give you some background information. We're going to talk through eligibility criteria for the program, and then how folks are able to be referred to the program. And then we're going to talk about our third-party administrator for FCS, AmeriGroup, who is a managed care organization here in the state who runs FCS on the state's behalf. Or in collaboration with the state, I should say. And then we're going to give you a little bit deeper of a dive into each service that we have here as part of FCS, as FCS is a benefit, and it has two services under the FCS umbrella. That's supportive housing and supported employment. And we've got folks here with quite a bit of knowledge of each side of that FCS house, if you will. And then we're going to talk about some new initiatives that are related to FCS. We've got a lot going on in the foundational community supports world that we're excited to share. And then we're going to talk a bit about forging partnerships with FCS providers in your community. Partnerships are really at the core of foundational community supports, and we want to kind of talk about how building partnerships with agencies that are in your community can benefit folks that might be at a Walker home. And then also we'll talk a bit about how to become an FCS provider in the actual presentation itself. And then we'll have some time for Q&A. And so with that, I'm going to pass it to Kimberly Castle, the FCS Quality Alignment Analyst, as you just heard, and she's going to start chatting with you about what FCS is.
Thanks, Scott. Nice to see everyone again today. So let's talk a little bit about what the Foundational Community Supports Program is. So we are the 1115 Medicaid Transformation Project, part of that waiver. And so that means that we started out with a 5-year waiver in this program. And luckily, we were able to launch in 2018. Currently, we have about 26,000 plus individuals enrolled over that time. So it's been really exciting to see how many people we've been able to serve in foundational community supports. We are currently in our 2.0 of the MTP waiver, which means that we've been approved for another 5 years of amazing foundational community support services. And so we're super excited to be doing that, along with adding some new initiatives and changing some things around for the program. So really excited to be able to share a little bit of that as that comes about. Things as we know that we were doing before, like supportive housing being age 18 and up, we'll be able to change that to 16 and up. So we'll be able to serve some youth population in the housing side of the house, like we were able to in employment, and some things like that we're really excited to share down the road. Foundational community supports is really designed to address those health-related social needs, or the social determinants of health. So really looking at those folks and thinking about what are all those factors that folks need in order to be well and do well in their life and in their recovery. And so we know that we look at mental health and physical health, but also what are those factors that play into that really help someone live a well life, right? And so part of those are housing, employment, transportation, financials, things like that really help support someone in feeling well and doing well and moving forward in their recovery. And so that's what FCS was really designed to do, was to allow there to be intentional services around supportive housing and supported employment, to ensure that we're doing that really holistic approach of serving individuals, so that someone has someone working on their housing, all while still having someone working on their employment if that's what they choose, as well as someone working on their mental health, SUD, whatever that may be looking at, so that nothing is getting put to the back burner, because housing tends to be the crisis. And historically, that's what happens. We have one person working with an individual, and housing is the crisis, so everything gets put to the side so we can deal with that crisis. And the idea is that we want them to be served well, all, wrap around them and have all of these things addressed at the same time. Next slide, please. So part of what foundational community supports does is this is really about the services, right? So this is the supportive housing and support employment services. This is really to be able to have Medicaid pay for providing these services to individuals. But part of that is that we want to make sure people are being served well across Washington state. And so both of our benefits follow an evidence-based practice. So for employment, we follow the IPS, Individual Placement and Support evidence-based practice, that does follow 8 principles. Actually, there's more, but the focus in on 8 principles of the evidence-based practice, and Darren may speak to a little bit more of that in a little bit. And then we also follow the SAMHSA's model of permanent supportive housing evidence-based practice for the housing side of the house, which has 7 core principles that we follow in providing services to individuals in these benefits. If you look across these 2, you will notice that a lot of them really align with one another. The principles really, we share the core principles between these evidence-based practices, because we really believe in making sure people have choice, making sure people have access to the services, making sure that we're really diving in and supporting them immediately, and then working with them around those life skills and things along the way, and not having any expectation of readiness before they jump into either of these types of benefits and programs. Next slide. So let's talk about who's eligible for foundational community supports. So in order to be eligible for FCS, you do have to be enrolled in Apple Health. So if you have somebody that's not currently enrolled in Medicaid, that would be the first step, is to have them get enrolled in Medicaid. There are individuals that can support folks in doing that if you don't have someone trained or aren't working with someone that can help that individual. But there are ways to get people connected to that Apple Health benefit. Once they're enrolled in Medicaid, then we can start looking at their eligibility for foundational community supports. So like I mentioned before, currently supportive housing is 18 years and up, but that is changing in this next year. So we're excited to share what that'll look like once we build out that protocol. And then currently housing serves 16-year-olds and up for supported employment. So then we have, for both benefits, individual would have to meet a health need and a risk factor. And so those do vary between the employment and housing side, but for the health need, everyone needs to meet a medical necessity. So Medicaid requires that medical necessity, meaning they have to have a mental health diagnosis, an SUD, or need support in activities of daily living or living independently. So if someone meets one of those health factors, then we can go to the next slide, which will share those risk factors. For supportive housing, the risk factors, and it's just one, they have to have one health need and one risk factor. I like to say that because we give you this list of risk factors and everyone thinks, that you have to meet all of them, but you only have to meet one. So the first one for housing is chronic homelessness. So that is, we follow the HUD definition for duration of homelessness, meaning they have to have 12 months of chronic homelessness or 4 episodes in a 3-year period that equal out to 12 months consecutive of homelessness. So those individuals would be falling under that chronic homeless definition for HUD, except for we do allow couch surfing for individuals who are homeless. We consider that unhoused and would consider those individuals to be homeless, as well as we have the ability for individuals to self-attest to their duration of homelessness, which is unusual for homeless programs. So one of the things we allow is for an individual who may not be working with someone through shelter or case management to share their own attestation of how long they've been homeless, so that isn't going to be a barrier in getting them access to this program. The next one's frequent or lengthy stays in an institutional setting. That's hospitalization, inpatient, any kind of prison or jail type setting. So those individuals would fall under that. Frequent stays in residential care settings, again, multiple rotations in a year in that setting would allow for someone to be eligible for supportive housing. Frequent turnover in in-home caregivers. So if someone's rotating through 3 or more in-home caregivers in a 12-month period, that would make them eligible for supportive housing. Many of us have worked with individuals that have trouble maintaining that relationship with an in-home caregiver for a number of reasons. And so many of our folks fall under this risk factor. And the last one's the PRISM score. This one is a predictive score based on, their utilization of Medicaid. So individuals who have different diagnoses, use high cost services such as the ED and have multiple specializations for doctors and things like that would have a higher PRISM score. And so an individual that has a 1.5 or above in PRISM would be eligible. One of the things I like to mention about PRISM though is that not every agency will have access to PRISM. Typically that is a mental health provider or a primary care provider. And so that is something that you could reach out and get that documentation if you don't think they'd fall under one of these other risk factors. And you'll know who your folks are typically when you're serving someone, whether that PRISM score would be high or not. For employment, the risk factors are a little bit different. So someone that's in HEN or ABD, Asian Blind Disabled Enrollees, those individuals automatically are eligible for that supported employment benefit. Folks who are having difficulty obtaining or maintaining employment due to age, physical, mental health impairment, or TBI would be eligible for supported employment. Someone with a history of multiple treatments for SUD would be eligible, or someone who has an SMI or co-occurring. It doesn't mean that someone has to be in treatment or being actually accessing treatment at the time, but have a need for treatment, and that makes them eligible for that supported employment. All right, next slide, Scott. Thanks. All right, so one of the things we tried really hard with FCS is to make sure that we're screening people in and not out for these services and benefits. So we wanted to make sure there was no wrong door approach. One of the ways we did that really in the beginning of implementation is ensuring that we were able to offer this to different types of providers, meaning it didn't just have to be under the behavioral health bucket, but it could be those of you doing housing, employment. We have community action councils doing this program, so we want to make it open to many types of providers to make sure more folks could get access to the program. And then really thinking about how people could access it and getting referred to the program. So we do have a quick reference guide that's out there with the 1-800 number. An individual can self-refer, call up AmeriGroup at the 1-800 number and say, hey, I need these services. Can I be screened? AmeriGroup does a lovely job of getting people screened for eligibility. And in that case, they would send that individual to a provider in their community who's receiving external referrals. And that's one way. A family member can do the same thing for an individual. Someone might be getting services from a provider who already does foundational community supports, and they can access through that, or a partnership between agencies that can connect individuals to the program. We also have partners with ALTA, our Aging and Long-Term Services Administration. So we want to make sure that those individuals are also getting connected to this program. ALTA does their own case management. and do their referrals through that process. And so they have a little bit of a separate process for those folks that are receiving also services. And then, of course, those of us at DBHR, if we receive any kind of referrals, we'll make sure they get access through AmeriGroup in order to get people connected. We do have that quick reference guide. This is an active link, so when we send this back out, you guys can receive that, print it out. I say share it amongst anyone that might be interested. It has that kind of breakdown of the eligibility so that you can kind of walk through that when you're working with individuals. Next slide.
I just want to pause you real quick. There was a question in the chat. It says, what is the definition of lengthy and frequent?
I'm actually, Kimberly, you can answer that if you'd like, but I'm actually pulling that from our quick reference guide. I'm going to paste it in the chat for you.
Thanks, Scott. All right, so you may have heard me talk about AmeriGroup a little bit through this, and you're probably going, why is she talking about AmeriGroup? They are our third-party administrator. So AmeriGroup is really, we contract with AmeriGroup to provide kind of all that administrative side of the program. So they help us build our provider network. They're doing all of the service authorizations for individuals. So if you have somebody that's getting authorized, AmeriGroup is the one that approves or denies those authorizations. They're also the ones that do all the claim payment and counter tracking and reporting. So when you're working with an individual or you're serving folks, you would be billing to a clearinghouse to AmeriGroup, and then they would be reimbursing you for those encounters. They're doing all of that measuring outcomes and quality improvement that we're working with them, and then they're also working with us to sustain the program. Next slide. This is a snapshot of our FCS provider map. This is a way for you to go in and be able to screen where you're looking for maybe a FCS provider, and it'll tell you in which region, county, and city that providers exist. And then over to the side, you'll see that list. It pulls up who's providing services or who is contracted to provide services for foundational community supports. And that little icon all the way to the right, if you click on that, will give address, phone number, and tell you if they're receiving external referrals or not, and if they're providing supportive housing, supported employment, or both. So that's a great way to connect people to who might be providing services in their area. Next slide, please. All right, so we're always excited, and part of why we're here is to make sure folks know how to become an FCS provider. We want to build and expand our network as much as possible, and so you can connect with AmeriGroup at this contact information. There's a TPA amerigroup.com email address or a phone number that you can contact them, and they will start working with you to go through the steps of how to become a provider. We also have an FCS provider manual on the AmeriGroup website that you can access, and the link is on this slide. And then of course you can always connect with one of us at DBHR and just say, hey, we're interested in providing foundational community supports, and we would help you get connected to AmeriGroup and do an introduction so we can start that process. We do ask that FCS providers enroll in Provider One. It's really important that we're keeping track of individuals who are enrolled in the Medicaid program. So we want to make sure that folks are accessing that to be able to verify enrollment in FCS. And next slide, please. All right, so quite a ways back, and this report is kind of old, and we're getting ready to, I think, launch another or send out another report here shortly. And Scott, you might want, I don't know if you have a date or when you know that might be happening, but this is, I think, after about 18 months of services, we were able to get kind of a preliminary report of the services being provided in both employment and housing. And what we did see is that we were getting an increase in rate of people staying employed, increase of hours and wages. So that was really exciting. People are working more, increased in their wages of earning. And so that's really exciting. Then we had a decrease in arrest rates for folks enrolled in the supported employment program. So that's really exciting. It was too early during this time to really see a decrease in the ED or inpatients. And so I really think that in this next report, we will see quite a bit of decrease in those services, sort of service utilization as well, but we will have to wait and see. All right, next slide. And then for housing, again, positive impacts across transition out of homelessness. So more people getting housed and staying housed. We have more people placed in housing projects funded by Department of Commerce. We work really closely with Department of Commerce in our programs to ensure people are getting connected to the resources that they are eligible for. We have higher rates of in-home care services, which is really exciting, meaning people are really accessing the services that they need to stay housed and do well in their housing. And then again, we don't have that kind of significant decrease in numbers of utilization of the ED or inpatient, but I believe that when we see that next report, we will see a significant decrease. Next slide. All right, I'm going to turn this over to Darren Paschke to talk about supported employment.
Thanks, Kimberly. Thanks, Scott. Let's go ahead and take a deep dive into some of the core principles of the IPS model. And this model is an evidence-based program that's had multiple studies to compare data and is now a local plus a worldwide network of folks who are taking these principles, integrating into their program, and achieving higher rates of employment. When I was doing supportive employment in the community with a behavioral health organization, we were maybe getting 12 to 15% employment. Adapting to the IPS model through the numbers across the nation, it's more like 45%, and that's been consistent even through the pandemic. So definitely adhering to these core principles really reflects significant outcomes of employment for folks. There's actually 24 other principles for competitive employment. We're just kind of focusing on these ones, with the first one being competitive employment. And this really is a program and an agency focus that it goes from first coming into a program to the receptionist, maybe seeing some advertising or promotions on the wall that talks about the program, talks about diversity, talks about employment, and really focusing on attaining jobs for program participants that can be open to anybody at a minimum wage, and wage growth and promotion within that. So it's really that ability to open up employment, all facets for any participant, and really focusing on the individualized services that we mentioned a little bit earlier. IPS supported employment is integrated with the team. So this also looks at service providers, as the HCA has expanded the launch of FCS services from beyond the brick and mortar program that IPS was developed. We have a lot more different providers. So we're really looking at how those different service partners are brought together and being on the same page so that people are sharing information. People might be sharing changes in diagnostic criteria, medications, housing, stability, levels of engagement, and talking across the board. And for high fidelity, we really want to see this frequent interaction, given that not everybody can be at weekly team meetings, but we really want to see different levels of engagement and sharing the information and focusing on that medical necessity and the progress within that. So I think this is always good for people to be aware of if you make referrals to other programs who are FCS providers, that you should be part of that treatment team and you should be part of that discussion and getting updates and being able to prompt people to see where the progress is so that it's a fluid and progression towards employment. Zero exclusion really tied into people stepping back and not implementing any personal biases into somebody's job idea, education goal, or employment goal. And it really starts with, again, all the folks within an agency or an organization and a team that we're really going to honor individual preferences and individual ideas. This might take some education from direct service staff to case managers to therapists to the executive leadership team. I really think that's a key component for the participants who are really going to implement a successful zero exclusion, because you really get diversity and inclusion as part of this, and really valuing what people can bring to the table or their life experiences and how those can really intertwine with services to do promotion. I think certified peer programming is a great way to bring some of that zero exclusion philosophy to the table and really actively engage with folks to achieve that. It sounds simple, but when I go out and do fidelity reviews, this is a big challenge for organizations who might already have their policies and procedures in place and their structure that's been there for decades. And to really change that really takes that inside support and assistance from the executive leadership to make those changes. Mention a little bit about the individual preferences. So that's in terms of people who come and share their desire. Maybe there's a goal that they were never able to achieve. Maybe they had gone through some training or some education and not able to connect the dots and be successful in getting that degree. But we really want to hear from the person what their strengths and abilities and their desires. What really makes them excited to get up in the day and think about what they'd like to do. Sometimes this takes education. I worked with one individual who really enjoyed being around airplanes and jets. Working in King County, we had Boeing Field. And he wasn't able to be a pilot, didn't have the funds, didn't have that ability to go through that training. So I worked with him and we found him a job as a custodian at the Museum of Flight. So it's kind of bringing in some of those core goals and meeting some of the desires to be around that type of equipment. So sometimes it takes some research and we have to provide feedback back to people about there might be physical qualifications that they have to do. There might be some education, there might be some testing. So as an employment specialist, we can do some education and then provide that feedback to see if some of their goals can change or if you can move forward with some of that. But definitely it's getting everybody on board, like through the integration and zero exclusion, because sometimes it also takes some advocacy to educate the case managers, the therapists, the SUD team, whoever's that service provider supporting that person as part of the team to get on the same page, and sometimes to be patient and always nudging the person in a supportive way to attain their ideal goals. We also have benefit planning and education. This is a real critical part that we as providers do no harm. And that's an oversimplification in working with a very complex Social Security or state benefit systems. But it's really being to have those resources to get more education and educate the individual that it's their choice. But when you have income versus services that are provided, whenever you have assets, earned income, some of your public service benefits are going to change. I've worked with quite a few people over the years that have been on Social Security benefits, decide to go back to work, and they don't report to Social Security that their wages, that they have wages now. So they collect their check from the benefits and they collect their paycheck from the employer. And this can go on for years until maybe the IRS notices that there's income and they share information with their other federal providers. And then Social Security learns about all this additional income that a person may have received. And then they're going to ask for that back. And that's called an overpayment. And I think we're going to see a lot more overpayment situations coming back from the pandemic and staffing changes with Social Security. So I just want people to be very aware that that can be a critical part of this, and to really encourage people who decide to go back to work, that there is a lot of information that we can provide for folks to better understand the systems and their responsibility, or maybe the payee's responsibility or the parent's responsibility to do some of that reporting to avoid some of the pitfalls of not reporting. Rapid job search, we really want to honor that person's process coming through the door where they have an idea. Maybe it's about school, maybe it's about work, maybe it's about training, and then rapidly meeting some of those needs. It doesn't mean that we're going to go out and get a job tomorrow or next week, but we're going to start this process within 30 days for high fidelity to really see what information we can gather that matches the goal, so we can educate the person about the process, or we can be out and having face-to-face encounters and building relationships with employers, so we can bring back some of the information about what the hiring process is. You know, what are some of the things that people need to be aware of as they apply for jobs with certain employers. So it's a lot of time doing information gathering, and we really want to focus on, for high fidelity, for IPS is that it's a face-to-face process, but we really want to honor the person. If they're saying, hey, I have an idea, I want to go to work, let's bring them in, let's start that process soon. Systematic job development. This really relies on using the tools available from IPS and HCA. We put a lot of tools on our Pathways to Employment website to really be intentional about the tools and track information, and to be able to go out in employers and have employer contact. We really want to see this happening on a consistent basis, that people are coming into the program, completing the required documentation, setting up a goal, getting some information together to do a job development plan, and what the next steps are, and really work together with the individual to do that. So part of this is also the responsibility on the supervisor side to be able to track information, like on my staff going out in the community to meet employers. How many employers are they meeting per week? For high fidelity, that's 6 employer contacts per week. How often are they going in the community to engage with folks? So we want to see all that, and that process is followed. Time and limited supports. This is where people are able to receive this supports that they need until they feel like they don't need those other supports. That doesn't always fit well with in terms of benefits for programs. I've yet to see a program that has unlimited time limits to be eligible for, except maybe a clubhouse. I think maybe they have that. But in terms of FCS, that each authorization is for a certain amount of units, and that would be within 6 months. This is an individualized fee-for-service program, so you have a little bit over $3,000 per 6-month cycle to be able to bill. But if you need additional services, a mayor group is really good about prompting, saying your benefit is coming to an end. Do you need to reauthorize, or maybe an exception to services if you've used all those services up very quickly because the person's been engaged and very motivated, and you've been able to do some alignment and exhaust those funds, those units, and you can reapply for some of those services. So definitely, those are the 8 that we really look for. Why don't you go to the next slide, please? So these are some of the other pieces that's really important for IPS and for fidelity. For high fidelity, we really want to see intimate caseloads in terms of 20 or fewer for high fidelity. But we know many programs have a very difficult time meeting this number or operating financially within that. And so we do see some fluctuation about that. But I think it's very intentional for folks to have a small caseload, because we're going out in the community, we're meeting with employers, we're spending a lot of time with service providers and maybe even families in schools and doing follow-up contact with employers. So we know there's a lot for an employment specialist to do. A large partner here in Washington State and across the country is working with Division of Voc Rehab. Some good news with that: they are no longer in order selection, so we should see a lot more referrals process come through and people be eligible. So it's a good time to find out who your local VR partners are, and if you need some of that information, you can contact me and I can work to find out who the local offices are and the supervisors, so you can begin that sharing of information, because I'm sure everybody here, you have specialized services or specialized programming or some insight that makes you a subject matter expert working with people in recovery, and VR can really use that as they work with some of the population that they have. We really want to see employment specialists only focus on employment services. I've been in programming where funding evaporated, and all of a sudden you're an employment specialist and a case manager, and you're probably going to spend a lot more time on those life-sustaining skills in case management and dealing with some of those barriers and challenges than you will for employment. So that's why we have the small caseload and that very intentional piece that we want to see people just focus on that. Granted, as a team, there's going to be some times where maybe the supportive housing and supportive employment people work together and go in the community. We really encourage that, because I think that builds strong partnerships. but we really want to see the person focus on the vocational specialist. Another piece of the IPS model is that intentional piece. We really want to see people in the community for high fidelity. We really want to see 65%. It's a very high number. I have yet to see that. I was never able to attain that in my program, but it's a goal. It's not a standard that you have to do as the programming is. But I think it's good information that for you as a referral program, you might want to know how the program or how the agency meets some of these specific goals. Disclosure is a crucial piece of the relationship development with the individual, and how people focus on zero exclusion and integration, that we want to be sensitive to people's how they view themselves, not how we might view them. And as a job developer, I would go out and meet with employers. I would share my business card. So there was already a level of disclosure going on in terms of building a relationship. So people need to be comfortable with that. If you're going out and sharing information, what agency or organization you're with, how that might impact the individual's perspective of how they see themselves in the community. A lot of people don't really want that level of engagement, but it's always good to educate. There's that bandwidth of disclosure to meet the person's needs and what's going to help them attain their goal in the community. A sort of engagement is definitely working with other service providers. Maybe there's some recovery staff and employment staff can work together and go out in the community and meet people in their homes, or meet people in terms of getting other services in the community. We all want to see how can we bring that team closer together in terms of providing additional supports and dealing with changes, because there's going to be a lot of changes on the road to recovery and employment, and how we really work together to share information and bring that together. I've been seeing the chat kind of like just populate, so I wanted to just take a break and pivot over to see what there was about fidelity.
Yeah, Darren, there's one question I'll read out loud if you don't mind. It says,
Certainly.
Does high fidelity requirement of provider contacting 6 potential employers per week take into CCFWW inside ration geographical location in rural communities having much lower employment pool?
I don't know what that abbreviation is. So one of the things about fidelity, this is a model that they created decades ago. So the model does not change. The expectations are still the same, whether you're in an urban or rural environment, that you are providing some of those services. Granted, this is a barrier. I've talked to people in Eastern Washington. They might have to travel an hour and a half to get into the remote parts of Washington to meet with people. And you have that travel time, and you have a lot of challenges with that. And I can't minimize that that's a challenge. I was talking to a job developer in New Zealand. They have some of the same challenges in terms of how do they connect with some of the mining companies in the more rural places where those are where the jobs are. They might be 2 hours away. That's not really going to be feasible to do a lot of face-to-face contact. Some of that might take place virtually or on the phone. When I understand that that's going to be a challenge, and you have to balance your resources in terms of staff time and how much you can do. But the fidelity model, that doesn't change based on location in terms of that expectation of going out in the community and meet with people. And the one thing I think some of the people look at the fidelity scale and they think, oh, I have to get a 5 in every area. You can pick and choose. This is about fidelity. It takes time to implement, and you take the strengths of your program to match how you best meet the needs of the people. Because at the end of the day, that's what's going to be important, meeting people's needs and helping them attain employment. Is that helpful? Okay. So FCS for the employment services have 2 baskets in terms of services. So the first one is pre-employment services. So what are those services that we do to provide and support and that are billable to help people on their employment journey? So the first thing is creating a situation where you get information from people. So this In some parts, for definitely cognitive impaired people, I've seen a lot of the discovery process, which might take some time to meet with the person, to get to know them, get to know their strengths, some of the barriers, maybe concerns, bring in family to see where they're at and what the next steps would be. IPS has a vocational profile that we encourage everybody to use. And this year they just launched a new one, which is shorter and more user-friendly. So I'm excited about that, because I know we're all burdened by paperwork, but it really looks at the strengths and abilities and the work history and maybe some psychosocial challenges somebody might have, medications, hospitalizations, whatever those barriers, that we can capture that and begin that dialogue and discussion about that. And again, we talked a little bit about person-centered planning, individualized job development and placement. Just a word of caution, definitely during COVID, a lot of people weren't in the community. There's a real overgeneralized use of Indeed for job search. That's not really individualized. That could be a research tool, but we're really talking about going out in the community and doing that job development and support once placement comes up. Sometimes there's situations where job carving or customized employment might come into a situation, but maybe as a job developer, you're visiting an employer, learning about a job, you might be seeing maybe there could be some custodial work, or maybe there's some extra customer service work, or maybe something a few hours a week to take something off the burden of the staff or supervisor and create a new position. That's a little bit about job carving, customized employment. It really takes, I think, a lot of work to develop a relationship with the employer to do that. But once you're in an environment, sometimes you can see things flow and provide some feedback that might create a new job for someone. Talked already about benefits and education and counseling. We do a lot of that because I think financial education and people learning about their benefits is critical as people return to employment. A lot of folks ask, well, can I bill for transportation, or is transportation, a medical necessity service? It's not. I know it's part of the process for employment to going out. If you had the person in your car and you're focusing on some skill building or looking at some ways to decrease anxiety, increase self-esteem, that stuff can be crafted into medical necessity. But just going from A to B, or going to your unemployment job site and coming back to the office, that is not what we're talking about in terms of job development and job support of a person. That transportation is just part of that administrative piece of having an employment program. Build rapport. It's so critical to learn about people, build that relationship. When you have that trust in a relationship, things can definitely improve and have some success. A nice thing about IPS and FCS, they both focus on supportive education. A lot of the same critical elements are true for maybe supporting people visiting the campus, maybe going through a FAFSA form and making sure everything's aligned with that as you put that in for financial aid, or advocating for some grant money, or looking for some other providers for grant money for education, or just learning about different careers that maybe a community college or a trade facility can provide with that. I used to take people down to the union trade training places, and they would have to be educated about some of the testing and some of the expectations in the schoolwork, plus being able to perform on a job site. So really providing that information and giving that to the people to educate them and how to do supports if they choose to do that. And again, collaboration, that's why we're here, to talk about collaboration and really focus on that communication that takes place from you as a referral source to those partners in the community, whether it's another provider or division of vocational rehab. It's really important to share information and share the information that you might be an expertise that could really help somebody through the process for employment. Next slide, please. So this is a snapshot of those sustaining post-employment services. Sometimes career advancement does take place within an organization. I was just at a Fidelity review and met somebody who had worked at a Jack in the Box, and they had a great tenure of employment there, and an opening came up for a night shift manager, and the person was able to be promoted, and the service provider was able to provide that staff support during that transition. Again, really looking at career advancement can also be through education, getting some degrees or certification, maybe a short-term certification, but looking at what kind of things we could do to kind of really advance somebody's role in whatever career they've chosen. Sometimes our role as an employment specialist, a job developer, is being aware of the needs of the individual, and maybe there's some job accommodations that we can ask or advocate for. So this also is a piece of disclosure that the person would want to feel comfortable disclosing to the employer. They need something to get their needs met. I've worked with people on general accommodations in terms of how the bus system works and work shifts. Sometimes that doesn't always work out so well. So an accommodation is maybe somebody can start early or start late, or maybe they leave early because the last bus is at a certain time and it's not really safe for the person to be on the bus at night. There was one person we worked with, she worked with security because she worked a graveyard shift because there was an extra differential in pay, and that she would have a security escort to the dark parking lot just around safety for her. So that could be a lot of different types of accommodations. One piece is also a job coach. If you have a good relationship with the employer, that's where a staff person comes in and really helps the person learn their job or maybe implement some skills. Or some we had one person working at a factory, and the visual pieces in terms of what the part looked like in different stages of assembly really helped him put the parts together. So that's one way of working with the supervisor, putting some technical information within the cubicle that he worked to help him get to the parts, to help him meet his productivity goals. Sometimes assistive technology is helpful, and historically I've used Division of Voc Rehab for that, where maybe there's some shoe inserts, maybe there's some eyeglasses, maybe there's a mat that somebody has to stand on if like they're a greeter or a cashier at a store where they're standing a long time. Maybe they could do some assistive technology like that. That's very some of that is straightforward. There's definitely more complicated technology in terms of what the needs and the barriers of the individual returning to work. Part of the life of a job developer, a vocational specialist, is really learning about the job, analyzing what they see, and giving recommendations to the individual that really help them. Back in the day when I started employment services, that was called a task analysis. We would look at all the steps of a job, put that together, and see how the person could do and help them meet those different waypoints and benchmarks within the job. Job coaching, as I mentioned before, definitely helping the person in the individual on the job. It doesn't mean you as an employment specialist is going to be doing that, but you're giving coaching and redirection to make them more efficient in the job that they have. And again, I've already gone through benefits indication, but we talk about that a lot because it's such a critical aspect. Asset development as people return to work, and they have a paycheck that might impact their benefits, but there might be some other tools that we could use, like an ABLE account where they could put money in for savings that won't impact their other benefits, or help them, get their license to maybe get a car or different things like that. Or maybe they're very successful and they're making more money than they can on Medicaid. So we have to look at the Apple Healthcare's for disability so that they can pay into an insurance system to maintain their Medicaid so they can get those long-term supports, which ties into ongoing following supports. I always think that a good supportive employment program has ongoing supports more than 30 days, more than 90 days. When you get out to 120 or 270 days, that's kind of where we see things can really change in terms of people being successful or not. So we really want people to use that FCS model to continue those long-term supports to maintain that bridge to successful employment. Next page, Scott. So thank you. If you have any questions, please reach out for additional information or tools for supportive employment.
Hi, everyone. My name is Jackie Velasco. I apologize. I wasn't able to introduce myself earlier. I jumped in a few minutes late because I was coming off another presentation. But I work with Kimberly and Scott and Darren at DBHR on the FCS team as a supportive housing program manager for FCS. And I get to share with you a little bit about kind of what Darren just went over, but on the supportive housing side of the program. So like Darren was talking about IPS, the evidence-based practice we utilize for FCS supportive housing are the principles of permanent supportive housing, which are run through the Substance Abuse and Mental Health Services Administration. I know Kimberly kind of referenced them earlier, but just to do a little bit of a deeper dive, this evidence-based practice is just sort of the recipe that we know that when utilized, and the reason that SAMHSA sort of espouses it as their primary program for permanent supportive housing is it's a recipe that works. You might be a little surprised to hear from some of these principles. I know programs operate differently all over the place, and lots of ways of providing service is really amazing. And it's okay if recipes get adapted a little bit based on whoever is sort of proctoring them, right? But these are sort of the fundamental principles of permanent supportive housing that I would love to share with you a little bit about to better understand sort of what our expectations are around FCS supportive housing programs. So the first principle I'd like to discuss is access to a range of housing choices. This is choice of housing and living arrangements sufficient to meet a participant's preferences. So this is just leaving space for people to sort of weigh in on the type and location of housing that feels the most appropriate to them for their needs and goals. Just like anytime we've all been looking for somewhere to live, we have considerations that are important to us, whether we're comfortable with an upstairs unit or a downstairs unit for accessibility or for hauling in groceries, or in case there's a family that lives above you that's really noisy and you'd like to be on a top floor instead. So just making sure that when people are considering where they might like to live, that you're helping them to explore those choices and honoring those. That can include whether or not somebody chooses to be in recovery housing, or if somebody's preferring community-based housing, if they want to live close to a bus line, if they want to avoid certain apartment complexes because maybe that's a place that they used to use and they don't want to live nearby there anymore. So that principle of honoring choice of housing is a way that we can facilitate that for folks. Separation of housing and services. This would be functional separation between housing, I'm sorry, I was talking to promote by the chat. Functional separation between the housing management and services staff. So sometimes if a program owns and operates their own housing, they might have overlap in staff. So maybe they employ not a landlord, but like a what am I trying to say? They'll like a property manager and also support staff, like a case manager. And so just making sure that it's okay to have those roles in somebody's life, but that nobody who has the power to take away keys or to evict somebody or to collect rent is the same person that's providing support services to somebody. Just because if you're a person who's looking for help, maybe you've made a mistake, the same way I might be more honest with a friend or a case manager or support person in my life than I would be with my landlord about what's going on. If I'd like help around something that might have broken some rules, we like to see separation of those services just to keep things ethical, and also to avoid situations where people who might need to draw some hard lines sometimes around enforcing rules of housing, so they're not getting too pulled into sort of the social services side if their role is to be a property manager. Decent, safe, and affordable housing. We try and keep the cost of housing at 30% or lower of a person's income. That's what is considered affordable based on their income and perspective. I know a lot of folks sometimes align housing services, so they might be receiving case management and also be getting a voucher that sort of keeps them in that zone where part of who the program that's paying their rent requires them to pay that 30%. But if you can just be exploring ways in which housing can remain affordable. I know I get a lot of feedback sometimes that functional that's really challenging these days because rent prices are so high, and they are disproportionate often to what people are able to earn, whether or not they're receiving help. And so I understand that that's sort of a big ask, but definitely decent and safe. We like to make sure that also housing is being assessed for those things. We like to utilize the HUD housing standards. to go in and just make sure, are there covers on the electric sockets? Is there running water? Is there electricity? Are there any other dangers in the space? Would there be a mold issue? Are there other issues around infestation, things like that? Just making sure that before somebody's living somewhere that they're aware if the unit is decent, safe, and affordable. Integration of housing would be housing that is incorporated into the community or clustered with other people living with sort of that medical necessity that qualified them for services. So that can be, I know it's a little tough for recovery residences because sometimes those are separate, but if people are looking for housing that is integrated in the community, that we're not just saying, oh, you're a person who needs help, you need to go live in project-based housing, or you need to go live in this area of town because it's the only place with affordable rent. We like to make sure that just like anybody who's looking for a place to live, people are invited to explore their options in any community, and are also sort of coached and helped to feel like they could be welcome and included and feel safe and like a part of the community, no matter where they decide to have an apartment. It can also be an issue sometimes with a lot of people who might be receiving services together. If they're all also living together, that's just a lot of time with the same people. So sometimes that space helps people stay more successful in any type of service that they're accessing, housing or therapy or whatever else. Rights of tenancy. We like for people to have full rights as defined by a local tenant landlord laws, and that tenancy is not based upon program rules or treatment participation. I know this might be a particularly sticky area for you all, but that's okay. This is just a great place to jump off for discussion. We like for people to have rights, and if it can't be a full lease, if there could be a formal agreement that sort of acknowledges every party's responsibilities, what the rules are, and what people's rights are if something were to change, just like we all would prefer to have in our living arrangement, an apartment or a home or whatever else. That's an important piece of upholding fidelity to these principles. Access to housing. So making sure that access to housing is not dependent on demonstration of housing readiness. So we don't want to be creating barriers to housing, and we want to respect a tenant's privacy. That can be tricky. Sometimes we just want to make sure that if somebody is looking for housing, that they're considered ready to be housed, that we're not placing additional barriers in front of somebody that they need to overcome before they're assessed to be ready to look at housing, and also to remain housed. So I know different programs have different rules around those kinds of things, but in a perfect world, somebody's housing wouldn't be contingent on compliance with those rules. It would just be on contingent on compliance with their lease agreement, their legal lease agreement that is based just on local landlord tenant law. And then flexible voluntary services. Choice of an array of adaptive and scalable services that meet a participant's needs. Services should be consumer-driven, recovery-oriented, and evidence-based. So we just ask that people are in the driver's seat of their own treatment planning and their own journey, so that they're deciding what it is they want and need. When it comes down to all of these other principles, that you're sharing what's ideal, and ultimately somebody's deciding what it is that they want for themselves. Whether or not they interact with you, we encourage FCS programs not to have minimum requirements for engagement. I know a lot of programs say, if you don't engage with your case manager at least once a month, we're not able to keep you enrolled. That's not within the principles of permanent supportive housing. It's a natural ebb and flow sometimes that somebody would come in and out of service based on where they're staying or what they're up to, and that they shouldn't be penalized for sort of exercising those choices. That's a rundown on the principles. So if we sort of keep those in our mind when we're thinking about, okay, so if that's where we're coming from, what types of services might we be able to provide sort of within that would be considered billable services on foundational community supports? Conducting assessments. So excuse me, I'm getting ahead of myself. These would be supports that could happen before somebody finds housing. So you've met someone, they're looking for housing. That's one of the goals that they'd like to work on. These are the types of ways in which you could help. So pre-tenancy supports would be conducting assessments. That could be an assessment to sort of like a housing needs assessment, a housing wants assessment. Those could be assessments of different units. If you're going in and sort of assessing them for quality and safety, you could definitely do that with a participant to make sure that you're understanding their housing needs and goals, and also to make sure that the places they're looking at are safe and habitable. Something that can be really common for folks, especially with housing quality assessments, is if you've been unhoused for a long time, and that was the criteria that sort of helped you be eligible for services. Sometimes people might not think to ask some of the questions around like whether or not a place has running water, or they might feel comfortable living in a place that you would like to encourage somebody to think about maybe raising the bar and be like, yeah, hey, we're looking for places. You don't have to accept a place just because it's a place that's available. You can get a place that you want, that makes you feel safe, and sort of assessing the space for that is definitely a service that would be considered a pre-tenancy support. Coordination of care. So if there's somebody who has lots of professionals supporting them with sort of myriad needs, making sure that you can kind of keep those lines of communication open. Sometimes when somebody has lots of supports, messages get lost in translation, or not every piece of information is shared with every member of the team, but it affects every member of the team who's trying to do their best to sort of holistically support somebody. So definitely stepping into that role and making sure that everybody's communicating and coordinating that care. Developing community supports, because it's great to be a case manager supporting somebody and sort of being that professional role in someone's life. And also the goal for sustainability is that somebody would be sort of embedding in their community. And it takes some strong, healthy, good relationships in any person's life to sort of just make life feel like it's moving forward, to make you feel like you have support, you have somebody you can call when you have a bad day or when you need a hand. So that could be a recovery community, that could be helping people build friends, it could be helping get to know, you know, people in a particular apartment complex where somebody's hoping to try and live, just those types of community supports. Treatment planning, which would be establishing somebody's short and long-term housing and other goals. Goals do need to be related to housing, but they can include some of these other items you see on the pre-tenancy support list. Advocacy. So sometimes if somebody needs some help accessing community resources or becoming eligible for other things, and they're not quite sure how to advocate for themselves, sometimes having a professional be able to step in and absorb some of that discomfort can go a long way in getting people connected to additional resources. Landlord liaising is a big one, and that includes going out and looking at units, includes calling apartment complexes or units you saw listed for rent, and getting information about what their, sort of criteria are for new move-ins, what the costs are, if there are any application fees, sort of talking to landlords ahead of time and saying, hey, I've got a person I'm working with, if you of course have that permission from that person, a person I'm working with who would really love to be housed here, but we'd like to know a little bit more first about if you are open to accepting double deposits or some other things that might help somebody who otherwise might not meet the move-in criteria to be accepted somewhere. Financial skill building. So if you're talking to somebody, if you'll remember, I mentioned that principle of sort of not adding additional barriers to housing readiness. And so if somebody is not currently working or doesn't have any income and would like to find housing, it's definitely appropriate as a support to help them start looking for housing, and also to talk about financial skill building around, okay, so you're going to have rent. We're going to explore sort of what public programs might be able to assist you with rent. And it also sounds like maybe you'll need to start thinking about where you'll get money to cover that. If rent is going to be X, Y, and Z amount, or they're going to take 30% of your income, sort of starting to build that financial literacy and what it would be like to build a budget, that kind of stuff. And then benefits support, I kind of referenced already, but that would be in assessing somebody's needs and goals and sort of learning more about what they might be eligible for, seeing if you can't get them plugged into additional benefits, whether that's Social Security or housing essential needs programs, CBRA, TBRA, all those kinds of different programs, rental subsidy programs that might be able to help, getting on food stamps, getting enrolled in classes are eligible for the FAFSA, all those types of things that somebody might be entitled to as public benefits would definitely count. And then tenancy sustaining services. This would be once you've worked with somebody and you found somewhere for them to live. One of the beauties of FCS supportive housing, just like Darren mentioned, the IPS principle of continuing to serve somebody. So just because somebody becomes housed doesn't mean that services need to stop or slow down. It is all dependent on the participants' interest in continuing to work on things and their continued need to sustain housing with some support. So these are things you can do with somebody once they're housed. for a lot of folks that I've worked with in the past, sometimes this is where the bulk of extra challenging work starts, because finding a place is one thing, but sustaining it, maybe when it's been a while since they've been in a place, maybe they've never lived independently before, maybe they're sort of relearning to be independent in a world with a different skill set than they had before, or trying to avoid things that used to be part of their life that they don't want as a part of what they're trying to work toward now. So these services can be really helpful at just kind of keeping on if they're interested in continuing to engage with their housing support specialist. Coordination of care. So just like I mentioned for pre-tenancy, just continuing to coordinate somebody's communication around somebody's care team, making sure that information's flowing through all the professionals might be helping if there's a therapist involved, or if there's somebody else that a person sort of allows and signs a release for you to communicate with. You could certainly do that. Employment or vocational support. We do have a full-blown SCF supportive employment program for people who qualify and would like to receive employment support that way. It's sitting and helping somebody apply for jobs or sort of explore their vocational interests is also an allowable support through supportive housing as well. It would not, of course, be as in-depth as what Taryn was describing for FCS supported employment. Informal community support development. So once somebody's housed, maybe encouraging them or seeing how they can plug in with other folks who live in their building. Do they do like building events? Or do they live down the street from a cool like restaurant or cafe where they can maybe go to an open mic night and meet somebody, you know, make some friends, just developing those supports so that people can start building a network outside of just those support professionals, if that's something they've done. Or if maybe somebody's prior support network isn't in their life anymore and they need to start rebuilding a net of relationships. Development of independent living skills. So that would be helping somebody learn how they're going to cook, learn how to keep an apartment clean, learn how to operate the machine at the laundromat, like all those different things, how they're going to catch the bus to and from their new job, from their new apartment, that kind of stuff. If those are things that someone needs to learn how to do, supporting them and learning how to do those things is great. Continued advocacy, as I described pre-tenancy, just continuing the same types of things. Treatment planning, updating somebody's goals. A lot of the time when you first meet somebody and they're not housed, their big goal is to become housed. And so even if you've broken that down into littler goals and somebody has become housed, sort of re-looking at that and saying, now that you are housed, what housing related goals would you like to continue working on? And just making sure that that process is staying live and dynamic and up to date. Increasing activities of daily living. It can be a really big change to become housed in a new type of housing, or if it's been a while since you've been housed, and that can have a fluctuating effect on your mental wellness and your interest in sort of exploring activities of your daily life. So just helping increase those for somebody and making sure that they're connected. Retention, which would be retaining their housing, that can go along with landlord liaising. Once somebody's housed, some things might come up. They might make a mistake on their lease, or maybe they feel like a landlord isn't being fair and they'd like some help looking back at their lease and seeing if perhaps there's some recourse or better understanding their lease agreement and what could be done for landlords, like not fixing something in a timely manner, that kind of stuff. Or if you were to get a call from my landlord on a Monday morning about the really cool party I threw on Sunday that's going to get me kicked out of this building because it was perhaps a little too cool of a party, being able to sort of talk landlords through that situation and maybe back from the ledge a little bit. And benefits management. Sometimes once somebody's housed, their benefits will change. Once they're employed, if they become housed and employed, benefits will change. And that's what that would look like.
Awesome.
I think that's all I got. If my team had anything they wanted to add or anything like that that I missed, they're welcome to jump in. If anybody has any questions, I'm happy to answer.
That was great, Jackie. Thank you so much for running through that. And if there are questions, feel free to raise them now. Otherwise, I'm gonna start to blaze through the rest of our slide deck here. Just got a few other things to touch on. First thing being the Transition Assistance Program, or TAP program. just kind of wanted to touch on this very briefly, and I'll tell you why it's going to be brief here in a second. But back during the 21-22 biennium, Washington State's legislature offered about $6 million for shorter-term rental assistance within the FCS program. And so we see that as some interim rental assistance opportunities that we offer our FCS supportive housing enrollees. And so I just kind of want to highlight that currently the supportive housing enrollees are the ones that have access to that funding. AmeriGroup, the FCS third-party administrator, is also the third-party administrator for that short-term interim rental assistance that we have as part of the FCS supportive housing network. And they're the ones that reimburse providers with TAP funds when they're spent in accordance with the rules of the program. One thing to really highlight, I just want to make this really clear that currently we do not have any funding for the remainder of state fiscal year 23. So this current year, we have expended our funding, and we will be renewing the funding coming the next state fiscal year coming up in July of 2024. And so once we have that funding, it'll be released to our provider network again. But we are working internally to make some changes to the program. Just kind of want to highlight that as well. You know, the aim of TAP is to lower or remove financial barriers to housing stability. And so when enrollees are seeking longer term support, TAP can be used to cover costs that are not covered by that longer term rental resource oftentimes. So oftentimes that looks like move-in costs, first and last month's rent. You know, and then also items such as IDs. When you don't have an ID, it's oftentimes really hard to gain access to housing, especially permanent housing. And then also TAP will cover application fees and more. We have, you know, covered some past due rents in the past in the program as well to keep people current and avoid eviction. But again, we are going to be revisiting TAP over the next months to do some reconfiguration of the program to make sure we're maximizing the fund for the benefit of our FCS supportive housing provider network. Just wanted to list out some of the longer term rental resources that TAP may lead to. You know, we have, you know, Section 8 project-based and housing choice vouchers or HCVs. You know, those oftentimes do not cover those move-in costs, and so TAP can be a coverage or provide coverage there. There's also 811 units, Project 811 units, which are managed by Commerce. And then really any sort of project-based or tenant-based program TAP can kind of be braided into or tied into or sequenced into. We'll talk about that in just a second. You know, I think that kind of leads to something that I really like to highlight about foundational community supports, though. You know, this program is founded on partnerships. You know, we at the Healthcare Authority work really closely with our Department of Social and Health Services, ALTA, or otherwise known as the Aging and Long-Term Supports Administration at DSHS. And as you heard from Darren, we also work with DVR as well. And so really that collaboration and partnership is really at the core of this program. And so as I was mentioning about braiding funding, you know, especially rental assistance funding, we really like to talk about how people can braid or weave funding resources together and even sequence them in a way that supports the long-term housing stability of the person that we're serving. And so I just want to highlight that that's kind of a partnership as well, in addition to these agency, you know, level partnerships that we work on together with our sister agencies here at the state. We also work really, you know, closely with AmeriGroup, our third-party administrator, to you know, make FCS work and function really well for our provider network. And we're always seeking to make improvements. And AmeriGroup is, you know, always part of that improvement space as well. They do a lot of quality assurance reviews on our behalf just to make sure providers are, you know, keeping things right and tight as far as how they're documenting services. And then HCA also collaborates, you know, to align initiatives internally to DBHR. We have a lot of outreach and engagement services, as well as some funding or service funding that goes out through HARPS, being one of those programs, or housing and peer recovery supports. You know, another program that really ties into FCS in the way that HARPS serves folks who may be uninsured or underinsured, and then once connected to Medicaid, then FCS can be a resource for that person. And I just want to highlight that most, if not all, HARPS providers are also FCS or foundational community supportive housing providers. And so that kind of that braiding or weaving of this resource, this service resource, and the subsidy funding piece, when it's available, can really be a nice continuum for someone to travel through once they become insured, if they become insured under Medicaid. And with that partnership piece, really just kind of wanted to highlight landlords and creating networks of landlords in your community to be a resource for folks who are seeking permanent housing can be a really great partnership. Oftentimes, it can be, how do I want to say, there's a timeline to that. It takes a lot of practice to engage landlords and kind of create that Rolodex, as a case manager and an agency. And just kind of want to highlight there's like internal partnership that needs to happen to kind of create that, as well as external partnership to create those networks of landlords that are interested in renting to folks that you may be serving with FCS, or that providers who you may be partnering with may serve. And that's kind of where I want to end on this partnership piece. I think that one thing we've really seen in FCS be a great success is community-based partnerships among agencies and housing providers, where a housing provider would be providing the housing, and an outside entity, a service provider, provides the foundational community support. So bringing folks from the outside to ensure that separation, that functional separation of housing and services, to make sure that if that person were to leave the housing they're currently in for any reason, that they have access to that that behavioral health support through FCS. They maintain that care coordination, and they maintain that housing support that would follow them to their next stop in housing, whether that be a place that's permanent or not. And I think that that's something that's really critical about FCS to keep in mind, is that FCS does travel with someone long-term, so long as they maintain their Medicaid coverage. And I just want to check with my colleagues to see if they have anything to add about that partnership piece. We oftentimes talk about partnerships as a really critical piece, and I've got some experts in the room, and just kind of want to make sure that I'm covering everything appropriately here.
I think you did a fantastic job.
Awesome. Great. Thank you, Kimberly. I know that we've been talking about partnerships quite a bit lately, and just want to make sure that I cover all my bases, because it is really about unlocking the potential in your community through those partnerships, right? There's all these different resources. Case managers are out there with boots on the ground, trying to serve folks as best they can. And without those partnerships, oftentimes people can get kind of caught up and stuck and hit barriers and dead ends to certain things. And so really just want to highlight that those partnerships relieve some of those barriers and help people along their pathway to housing and employment stability. And so you'll see on the screen here just, pretty much what we consider as, common partners across regions here in Washington State for FCS providers, or agencies that may be working with an FCS provider. These are different angles that we see being really critical to provide support to the network of folks that we were serving with this benefit. And while it's really critical to, generate, it's also critical to maintain those partnerships. Generating those is one thing, but then maintaining them is kind of another. And here you'll see on the screen just a lot of different ways or methods that folks can maintain those partnerships. Keep it simple. It's not always about making a complex partnership that creates tension in a certain way that may not best serve the folks that are being served with FCS. And oftentimes you have to create buy-in. You have to kind of talk about what it might mean to the folks that you're serving or your partner is serving with FCS employment services or supportive housing services in a way that's going to positively impact the community that you're in and that person's well-being and overall health outcomes. I think that that's something that really helps generate that buy-in, is to kind of take that perspective of how FCS is really aiming to improve people's pathway to recovery, and that a landlord or an employer can really be a part of that process, as well as those partnering agencies as well. I think regular check-ins and conversations and communication is also a really critical piece of maintaining partnerships. And so just want to highlight that there are different ways to do that. It's not all one size fits all. It's really about kind of reading the room, seeing how people want to work together, and moving on from there. Sometimes that might look like an MOU, or some a more formal agreement or informal agreement. You know, really, there's just a spectrum of ways that you can do this, and we really want to highlight and encourage those collaborations across the state. With that, I'm going to move into some of our upcoming FCS-related initiatives. So, you know, we have a really great opportunity and have had a great opportunity to be working with inpatient facilities known as Institutes for Mental Disease, or IMDs. So you'll see IMD on the screen. That is something that we are consistently and constantly working on as far as folks, you know, getting folks to gain access to FCS supportive housing and supported employment services while they are currently in an IMD facility, so that once they exit, they have maybe a little bit more planned out as far as their housing and employment goals, and take a little action through their case management, perhaps before they even exit, in a way that supports that landing in the community of their choice and an employer of their choice or housing of their choice. I'm going to pass the next one, Glide Path, to my colleague Kimberly Castle here, because she's been working pretty hard on standing this up recently, and I think she'll do it best. Go ahead, Kimberly.
Thanks, Scott. So just to share a quick little new initiative that we're launching. We actually launched last year, but we're really getting full-fledged into Glide Path this year. Glide Path is an initiative connected to our supported employment program. It's also a collaboration between the Healthcare Authority and the Department of Commerce. So lots of partnerships happening here. And what it is we are working with the HEN program and helping support individuals who are enrolled in FCS supported employment who are increasing their income for going back to work, and they're falling off the HEN benefit for that reason or other reasons, and now need some additional support, right? So what we want to do is ensure that folks get some additional time to get kind of in that self-sufficiency stage as they go back to work. And so HEN is, for this particular population, will offer 9 months of additional rental assistance to these individuals to give them a little bit more time to have that getting used to having some income and learning how to access their benefits, which leads me to the part that HCA is involved in. So with that, we're partnering with Department of Commerce. They have the HEN funding for these individuals. And what we're doing is contracting with an agency in every region to provide additional supported employment benefits for these individuals through FCS, but also benefit planning. The whole idea behind Glide Path is to help individuals access benefit planning so that they are not being disincentivized for going back to work. You really want them to learn their benefits, how they can utilize them for, get the best bang for their buck and really still go back to work. We know people can go back to work. A lot of time they're just afraid to because they don't want to lose those benefits. So our purpose is to provide benefit planning across the state, have more access through these entities. So these agencies who are contracting for Glide Path will be able to provide benefit planning for the region, increase supported employment support, and hopefully get these people connected also to supportive housing support if they need, and that HEN benefit. So we're really excited to be launching this. It also comes with some flex funding for individuals in supported employment who need work clothes, certification, ID to go back to work, all of the stuff we know that doesn't always get covered under other funding. So we're excited to be able to offer this. And if you have additional questions, please feel free to reach out.
Thank you, Kimberly. Great overview. And now I'm going to move on to Apple Health and Homes, a really exciting new initiative that we like to call AHA. And so you may have heard of AHA or Apple Health and Homes in the community recently. That initiative that we're working so hard right now to stand up comes from a really exciting piece of legislation that came out a few years back, coming from Rep. Frank Chop, House Bill 1866. And so what that bill really did was direct HCA to work closely with the Department of Commerce's new Office of Apple Health and Homes and Permanent Supportive Housing, first of its kind here in the state, to really stand up alongside DSHS's ALTSA, this Apple Health and Homes program in a way that FCS pre-tenancy and tenancy sustaining supports will be paired with bricks and mortar housing, a la mostly rental assistance vouchers, but there's also some capital funding, quite a bit of capital funding coming out for our Apple Health and Homes initiative as well. And so I just want to highlight that that's something that's really exciting that's coming down the pike here in the coming year. And like I said, we're tirelessly working to stand that up in collaboration with the Department of Commerce and DSHS's ALTSA, as well as AmeriGroup, our third-party administrator, who's going to play the role of the coordinating entity for Apple Health and Homes, or AHA. Another really exciting initiative that we have is that I think something that may not have been mentioned before is, as we are a benefit, our service authorizations, they're really Medicaid oriented, and they come in 6-month increments right now for both supportive housing and supported employment services. But we have a really exciting opportunity kind of coming from that House Bill 1866 piece, as well as the approval through our federal partners and our agency to start providing 12-month-long service authorizations for supported employment or supportive housing, 12-month service authorizations for supportive housing only right now. And so we're currently working together to just kind of understand the potential impacts of implementing that, and then we'll be standing that up here pretty soon after. As we know, that leads to less administrative burden for our provider network to keep reauthorizing folks for FCS supportive housing services. Also, a really exciting thing that happened recently, and I'm going to race through this, y'all, because I know we're really limited on time right now, is our Medicaid transformation project renewal. Kimberly, I believe, mentioned a little earlier that we received approval from our federal partners, Centers for Medicare and Medicaid Services, or CMS, for MTP 2.0, or the Medicaid Transformation Project 2.0 here in Washington State. And so what we are offered through that exciting opportunity as a program, as we are initiative 3 of that MTP, is to expand FCS supportive housing eligibility in a way that serves 16 and 17-year-olds with supportive housing services. Currently, the services only support folks who are 18 and above. We will be implementing that here pretty soon, but we're working internally and with our provider network and beyond to understand the unique housing kind of circumstances folks who are 16 and 17-year-old may find themselves in, so that we can best serve them through the network in the future. Also, I want to kind of highlight that Medicaid or CMS has approved that one-time transition cost coverage piece, as well as payment for up to 6 months of rental assistance. We are currently working with our federal partners to establish those protocols. It's going to take some time for us to stand that up because it is a back and forth with our federal partner CMS. And so we're working really hard to kind of establish what that's going to look like. And you'll hear more about that coming down the pike soon, as well as a great opportunity to start serving folks through a reentry portion of that MTP waiver before folks exit jail or prison in a certain amount of time prior to their release. And so FCS, hopefully in the future, will be stepping in to provide a bit of a pre-release support to folks who are returning to a community of their choice after institutionalization in jail or prison. The big note here is that last one on the bullet. None of this has been implemented yet. This is all just really exciting opportunities that we have within the FCS program that are coming down the pike. With that, I'm going to do a quick wrap up here. Just want to thank Kimberly, Darren, and Jacqueline for joining me and talking about FCS in this room today. We really appreciate folks sticking it out with us, and would love to hear if there are questions in the last few remaining minutes that we have. And if none, our emails are all listed here in the slide deck that I'm going to share with Blair and Walker after this presentation's over. I'll be sending that over here pretty quick, I hope. And if anything does come to mind, if you have something on your mind now and don't want to bring it to this space, that's totally fine. You can reach out to any one of us with a question, and we'd be happy to provide support.
Thank you, Darren. Thank you, Scott. Thank you, Kimberly. And thank you guys all for joining us today. We'll be following up with an email with a survey and then the slides for you. And yeah, we'll have the recording up for you guys probably like 24 hours. So I'll be looking forward to that. And thank you guys all. We hope to see you soon. You can RSVP for more webinars on our website, walker.com or walker.org/RSVP. Thank you.
Awesome. Thank you, everyone.